For decades, the Veterans Health Administration, the VA, has been this sacred promise we make as a country to care for those who've served. But right now, that whole system is facing a huge choice. Does it double down on its own way of doing things, this integrated model of care, or does it keep sending veterans and, frankly, billions of dollars out into the private sector? This is the story of how the VA got to this exact crossroads. So, to really get why this whole push for private care even started, we have to jump back to 2014. We have to look at a crisis that absolutely shook people's trust and showed how a promise could be so tragically broken. Okay, so picture this. April 2014, a bombshell report from CNN drops. It uncovers this massive scandal at the Phoenix VA. And the problem wasn't just that veterans were waiting a long time to see a doctor. No, it was an intentional cover-up. Internal emails showed this whole scheme to hide the fact that thousands of veterans were being left to wait, sometimes with absolutely devastating results. And look, this wasn't just some abstract bureaucratic problem. This had a real human cost. Let me tell you about Thomas Breen, a 71-year-old Navy vet. He finds blood in his urine. The ER tells him he needs to see a specialist, like yesterday, urgent. His family starts calling the VA over and over again. It took them almost 10 weeks to get him an appointment. And when that call finally came, his daughter-in-law had to break the news. He'd already died the week before from stage 4 bladder cancer. The VA's response? We're a little too late, sweetheart. So how on earth did this happen? Well, it turns out officials at the Phoenix VA were basically keeping two sets of books. You had the official list. That's the one they sent up the chain to headquarters in D.C., and it made everything look great, like vets were getting care right on time. But then there was the secret list. And that one told the real story. It showed veterans waiting, in some cases, for more than a year just to see a doctor. As you can imagine, when this news broke, people were furious. The public demanded something be done, and fast. And the solution that came out of it all seemed like just common sense, right? If the VA can't give you care in time, then you should be able to go somewhere that can. And that's where the VA Mission Act of 2018 comes in. This was the big official policy fix. What it did was dramatically open up the rules, making it way easier for veterans to get care from private doctors and hospitals right in their own communities, all paid for by the VA. They call it community care. And this wasn't just some small change. We're talking about a massive shift in money. Spending on this outside care more than doubled in just 7 years. It jumped from just under $8 billion in 2014 all the way to $18.5 billion in 2021. Billions and billions of dollars were now flowing out of the VA and into the private healthcare industry. So you might be thinking, is this just a VA problem? Well, not even close. Actually, what the VA is going through gets at this universal tension that pretty much every public healthcare system in the world has to deal with. Just take a look at these charts comparing what patients go through in the US and the UK. They really spell out this universal trade-off. Over here in the US, patients say they can get care pretty quickly. But man, the financial burden is high. In the UK's National Health Service, it's the total opposite. You don't have to worry about the cost, but you might have to deal with really long wait times. It's this constant balancing act between speed, cost, and access. Which brings us right back to the VA. Remember, the solution to its crisis was more choice, more private care. But this raises the most important question of all. Did it actually work? Well, the answer, as it turns out, is a whole lot more complicated than anyone really expected. Check this out. There was this fascinating study from researchers at the University of Pennsylvania. They looked at veterans who needed major heart procedures. And on the one hand, the Mission Act was a clear win. Travel times to get to an appointment went down a lot. But, and this is a big but, for really complex stuff like coronary artery bypass surgery, the rate of major bad outcomes, we're talking heart attacks, strokes, it actually got worse for the veterans who went to outside doctors compared to the ones who stayed inside the VA system. And that study wasn't a fluke. This quote here is from a massive review of 37 different studies that came out in 2023. And the conclusion was pretty stunning. The researchers found that, consistently, VA care is just as good as, and often better than, care on the outside. So what gives? Why the difference? Well, a lot of experts point to the VA's integrated system, where all the different specialists can easily coordinate on one patient's case. Plus, VA doctors develop this deep expertise in conditions that are really common for veterans, from PTSD to the effects of toxic exposure, things that your average private doctor just doesn't see very often. So this is where we are today. The VA is stuck between two things: a really popular policy that sends billions of dollars to private providers, and this growing pile of evidence that says its own in-house care is actually remarkably good.
If you follow the money, you can really see the challenge. Here's a look at the 2025 budget request. That huge number at the top, over $192 billion, that's mandatory spending. It's for things like compensation and pensions that are required by law. The smaller, discretionary budget is what's actually up for debate to pay for healthcare. And right there, you see the tension. A request for over $20 billion to go to private community care, right next to $71 billion for the VA's own medical services. Every single dollar spent outside is a dollar that's not being invested back into the VA's own hospitals and clinics.
And this gets us to the heart of the whole dilemma. The push for more choice, it came from a very real, very serious crisis of access. But has the solution created a whole new risk? Are we accidentally dismantling a high-quality, integrated system by slowly bleeding it of the patients and the resources it needs to survive? And that is the fundamental question at the heart of the VA's Crossroads. It's a choice that has massive implications, not just for the budget, but for the very soul of the promise we make to the people who've served this country. And believe me, there are no easy answers here.